So let's get started. So I like to introduce the facilitators of tonight's session. So I'm going to talk a little bit, but then I am going to pass it on to other folks. So folks just want to give a wave. So Heather, Lisa, and Rebecca will be facilitating this session. Yeah, so I will get started and then we will all right. So before we get into the session, anytime we do a presentation, it's really important that we take the time to do a land acknowledgement. So I just want to acknowledge that the land we are on here, University of Manitoba, located on the original lands of the Anishinaabe, Cree, Oji-Cree, Dakota, and Dene peoples, and on the homeland of the Métis Nation. We're committed to learn about Indigenous peoples' culture, their suffering, and to understand their frameworks, proposals for healing and confronting oppression. We are committed to educating ourselves to avoid adding to stigma or perpetuating discrimination or damage. And so as us, as individuals, as a research and as a team, this is really important to us to make sure that we're continually listening, learning, and trying to do better. All right, so for tonight, the topic that we are going to talk about is cultural safety and STBBI threats. So what we're going to cover tonight's session. So we're going to talk about what is cultural safety and define that. Why is it important to consider for HIV and STBBI care? We'll get into what is STBBI in a minute for folks who don't know. So what are current gaps and unmet needs? Cultural safety and Indigenous peoples in Canada. We'll talk about Indigenous approaches to health and well-being, and then we'll end with cultural safety and practice. So look at what is currently happening, like good things that are happening that people are doing to create cultural safety in healthcare. All right, so before we get into the topic at hand, just wanted to quickly define STBBI because some folks might not be aware. We're not going to talk about kind of what are really STBBIs tonight. What are the kind of ones that we've listed? We are going to cover that in future sessions. I just wanted to let folks know because you're going to see that acronym a lot. So STBBI stands for sexually transmitted and bloodborne infection. So growing up, you might have heard things like STDs or STIs. This is kind of the accepted term now. It's more appropriate, kind of more describes the infection that would be considered an STBBI. So it's an infection that's sexually transmitted or transmitted through blood. So most common through sex or sharing needles or drug equipment. So that's all we're going to talk about for STBBIs, the definition tonight, but the next session, we're going to get into kind of more of what those are. So why did we want to talk about cultural safety as our first session? Why is this important? So this image is taken from Manitoba HIV program reports infographic. Mariana designed it actually. So it is really important because in our work, we've identified from people with lived experience that, you know, despite healthcare providers' best efforts, there is interactions that are not always culturally safe. And along with like healthcare system failures, you know, overburden on the healthcare system, it can prevent people from getting the care they need. And one thing that we've identified in our work, so in Manitoba, why is this important? Why is this important to talk about? Because in Manitoba, there's been an increase in people being diagnosed with HIV over the past 3 years. And our research has been looking at why is this happening? So I don't know how clear folks can see this, but there's kind of been a convergence of factors. And so we call this syndemic when one or more diseases occur kind of at the same time. And just kind of these complex factors have caused this. So there's structural factors, social determinants of health, and we know that unfortunately Indigenous peoples in Manitoba are disproportionately affected by this syndemic due to ongoing impacts of colonization, structural racism, and intergenerational trauma. And so here's what the data is showing us about this syndemic. So between 2018 and 2021, there's a 52% increase in the number of HIV cases in Manitoba. And so these are some of the things that we've found. And we know that it can affect different people in different ways. And this information is really important for us to know so that we can tailor our approaches to helping folks get the care that they need, especially folks among newly diagnosed. We know that there's been overrepresentation of people experiencing houselessness, young females, people who use substances, and Indigenous people as well. So it's really important that we look at ways that we can meet people's needs. And one way we can do that is through cultural safety. So what is cultural safety? So I'm not going to go into a lot of detail about how the concept was developed, but I think it is really important that we know where this came from. So the concept of cultural safety was first developed by Irupeti Ramsden as an educational tool in nursing practice to address health inequalities confronted by the Indigenous population stemming from the colonization of New Zealand. So since 1992, they introduced it into nursing education and curriculum to try to address some of those inequalities and make people's experiences with healthcare better. So I really like this definition from the First Nations Health Authority of BC, creating a climate for change report. So what is cultural safety? An outcome based on respectful engagement that recognizes and strives to address power imbalances inherent in the healthcare system. A culturally safe environment would be one that is free of racism and discrimination, where people feel safe when receiving healthcare. What I think is really important about this definition is that it talks about an outcome, so it's action. So it shows that, cultural safety is more than a concept. Yes, that's how, we talk about it, how it was developed, but it's something that should be put into practice as an action to make things better for people when they're interacting with healthcare providers in the healthcare system. Right. So what are some elements of cultural safety? So in a paper that we'll talk about in a minute, they've identified kind of some common elements of cultural safety, kind of these main things. So client empowerment, so meaning that people feel empowered to make their own informed decisions about their healthcare. Recognizes that only the client can define an interaction as culturally safe, so not a healthcare provider, only the person who is receiving the healthcare can decide if it's culturally safe or not. It acknowledges and respects individuals in the context of their everyday lives, so their activities, their personal values, and life experiences. So kind of looking at the whole person and respecting that, there is so much that goes into making someone who they are, and there is a lot of different things. And that affects how people need to receive healthcare. It can also be used as a framework to examine relationships with power within organizational, structural, and institutional conditions. So kind of looking at what can organizations, for example, like hospitals, do to share power with people instead of that, relationship where the healthcare provider holds all the power. So looking at how can organizations introduce policies or practices to make it more of an equal relationship. It also considers how a healthcare provider's own beliefs, practices, and histories can shape the healthcare experiences of another. So this is like our own individual, how we grow up, our biases, things like that, how we interact with the world and how we interact with, clients and individuals in the healthcare system can definitely experience, can cause people to have, say, a negative experience or a positive experience with a healthcare provider. It also means providing care that's non-judgmental, that is free from discrimination and respects a person's human rights. So that is really, really important. So essentially, cultural safety is like a person-centered approach to healthcare that's focused on relationships, creating an environment of safety and trust between the healthcare providers and individuals. And now I'm gonna pass it over to Rebecca. Talk about the next couple of slides.
So it gives us citizen, right?
Yep, yep.
Okay. This is the same one?
Yeah.
Okay. Hi, everyone. I'm Rebecca. And she, her. Why is cultural safety important to consider for STBBI healthcare? One, all people deserve to receive healthcare in a way that respects their cultural values, beliefs, and practices. People must be able to maintain their dignity while accessing healthcare systems, the healthcare system. Racism, discrimination, and bias create power imbalances that prevent certain people and groups from getting the care they need, which can have severe consequences on one's health. That's it. Not it?
Yeah.
Okay. What are the current gaps in care identified by peers? Healthcare providers not listening to patients' concerns. Experiences of stigma and discrimination. Healthcare providers not sharing knowledge. Being outed with HIV or STDVI by healthcare providers, lack of prevention, not understanding the impacts of colonization and systematic racism affecting Indigenous people.
No, you're good. Okay,
Yeah.
thank you, Rebecca. All right, so now I'm gonna pass it over to Heather.
Okay, so cultural safety and Indigenous people in Canada. In 2019, paper from the Canadian Journal of Nursing sought to answer the question, what are the elements of a cultural safe health initiative for Indigenous people in Canada? So they reviewed papers from 2007 to 2016, and then identified 6 themes related to the elements of cultural safety and health initiative of Indigenous people in Canada. Okay, so the 6 elements of culturally safe health initiatives: collaboration and partnership, community collaboration, trust, respect between care providers and clients, power sharing, acknowledge power dynamics, recognizing the individual's strengths, address the broader context of the person's life, use indigenous social determinants for health approach, historical context, and how it impacts Indigenous peoples today, safe environment, provide safe environment where providers are non-judgmental, use cultural relevant resources, organizational and individual level self-reflection on personal biases, how those affect care delivered, examined organizational policies, training for healthcare professionals, cultural competency and or cultural safety training for providers. So when it comes to the training, I feel like the medicine wheel is important. It's our way of life. It's an important factor in understanding our way of life, because it's a circle, and we believe our life is continued. We're always from birth to death, but even then, after that, we're still in the spirit world. So our life never ends. We're always there. So as you see in the circle, because we believe everything is connected, it represents color, seasons, age, animal, medicine, and elements. But the most important thing for this project, I think, is when it comes to health, it's the state of well-being, which is the spiritual, the physical, the emotional, and the intellect. Okay, and we believe that without these 4 well-beings, life is unbalanced. So Indigenous approaches to health and well-being. There are many ways Indigenous people support their physical and mental health, including we burn medicines such as tobacco, sweetgrass, sage, and cedar. We prepare traditional medicines such as boiling medicines like for cedar tea, ointments for skin as in bear grease, and eating medicines as bear root. Getting support from elders and medicine people, such as teachings of the way of life, prayer, and prepared medicine. Being involved in ceremonies such as sweats, sun dances, powwows, and sharing circles, and camps that are run by tradition, such as living off the land and water.
All right, now, pass it over to Lisa.
Good evening, everybody. I'm Lisa. I go by she, her. And tonight I'd like to talk about what can healthcare providers do to ensure cultural safety for people living with HIV and or other STDs. Provide options and information for people to make informed decision about healthcare. Learn what trauma the person has experienced. For example, residential school, 60 Scoop, DFS, family history or experience of violence. And we would also like to share information about new treatments. What can healthcare providers do to ensure cultural safety for people that, okay, I just said that. Respect people's boundaries. Speak in languages and communicate in ways that are supportive and safe. Consider your role as a healthcare provider and how people may perceive your actions as safe or unsafe. Providing privacy for people to discuss STDBI healthcare. Training and education to address bias, racism, and prejudice. More Indigenous service providers and peer support from people with lived experience. And culture safety and practice. What approaches are local organization and providers taking to ensure culturally safe experiences when providing HIV and other STDBI care? I picked 3 spots, but I only actually got one to interview, and that was Ganiginichik's Minopematuan Sexual Wellness Lodge is meeting people's needs for STDBI care by following these best practices. They put effort ensuring the staff reflecting community. They engage elders and peers to guide work. Always have access to smudging, ceremony, medicines, and teachings from one another. And they think that their location, their accessibility, and it's got to be approachable for everybody. And I would like to ask you guys a question. Because I was supposed to do Aboriginal health and wellness, which I've totally forgot, and 9 circles, but I did get to Ganiginichik one. But what ideas for making healthcare more culturally safe? Like, you guys have been to Mamaway, you know what I mean? There's clinic with a K, there's Mount Carmel Clinic. So I would just like to ask you guys a question: what those organizations make you feel as culturally safe when you go there? Thank you.
So I'm just going to talk about an example for what I do. I work for 9 Circles. I work for Meet the Moment. We are a group of nurses, and I'm the cultural support worker. And we go out to the public. We go to shelters, homeless shelters, and camps and everything, and we bring healthcare to them. We also, with the healthcare, we bring cultural support, we bring medicines, we bring teachings, and also private conversations if they want. We are very successful. Unfortunately, we're not going to be around too much longer, And so I hope, with, with everything that we learned, and people learned from what we did, that, the government or anybody else will get more of these groups going, because it's very, very successful, and, people trust us, and that's the point. If people trust us, people will come and get more health.
What was the group called?
Meet the morning.
All right, well, we have a few minutes left, but we do want to make sure that, yeah, we give a few minutes for folks to discuss. So it's not just us up here talking, so folks online, do they have some questions? Do they want to unmute themselves and share some ideas, or do they want to just read it out?
It's up to you. I can read what you text in the chat, or you can share if you want. So, yeah. You want me to read it for you?
Does anyone in the room want to share what are things that organizations or healthcare providers could do to make healthcare a better experience for people, more culturally safe? Rob?
I mean, we are making many steps to make it culturally safe. And I think quite frankly, we doing a lot with indigenous people is the beginning for that. And we also know that it's not safe in all cultures in general. It goes across the board that there's a missing gap for many cultures, and people are losing out the health that they should be provided. Getting in touch with having cultural liaisons to be able to get in touch with and speak to the patient is number one. Having a way to get to the people if we're not in a position where that we can have them come to us. That is another way to be able to be accessible. And then obviously being personable, being able to be respectful to the client is key number one. I mean, if you have no respect, then you're not doing anything. You have to be providing any kind of help at all.
Thank you, Rob.
We have a comment from Rose. By learning and beginning to learn about someone's culture and avoid stereotyping too, by providing interpretation or translation services, understanding where people's perspectives are from. And Diana, would you like to speak now?
Yes, I'm sorry, I am outside, but I like to share. I am from the Colombian Association, and our medical system is so different, and our culture is so different. And what we do, the last year we contact with a Mexican, Latin speaking or Spanish speaking doctor and a nurse. We are trying to understand the system. That we can do. I need to go, so sorry, but I like to share that we try to understand in our culture and in our language the medical system and the faith system. Thank you.
Thank you. Anyone else want to share anything? I don't want to keep anyone too long, but I want to give folks an opportunity to share their thoughts.
Just with the communication thing that I was talking about before, like, I just think that, like, walk-in clinics here in Winnipeg, there has to be some boundaries, and I understand too, like, if we want to, we can also learn another language too. You know, from our own side to stay healthy and equal. But because of reconciliation, I just find it really rude when we go into a clinic and hearing another language being spoken fluently when ours was ripped from us. And I just think, you know, there's a time and a place for that. Like break time, lunch time, after hours, whatever, you know, but not when people are going through all this traumatic stuff that's happening to them right now, especially with it coming up. Mhm. Oh, and I always say, like, we always speak a different language too, because we speak the normal English language. We're not fully educated to speak the doctor's degree, nurse's degree, and you know, other stuff like that. So like, that's another gap.
Yeah, thank you, Rebecca. So just being cognizant of the time, it is 7 o'clock, so we will wrap things up because we don't want to, keep people, but there is now our post test. And then for folks in person, we'll pass out your honorarium. For folks online, we'll be in touch with you tomorrow about that. Yeah. Okay, so for folks online, Mariana's sending you the link to the post test. For folks in person, Zulma's gonna pass that out. And yeah,